Hi, my name is Joel Mason. I'm one of the co-chairs of this year's Advances in Controversies in Clinical Nutrition, and we just finished our first afternoon session of the meeting, which I thought went in a superb manner. What's new this year compared to last year? Well, every year we try to cover different topics, so the topics we covered this year are very different than the ones we covered last year. One of the topics that we started out with this year was the microbiome, which was interesting because last year's meeting, for planning last year's meeting, we strongly considered putting in a microbiome session, but we knew that there was some really interesting human data coming out over the last year and a half, and we decided to defer that session until this year because we really felt that by waiting an additional year, we'd really have much more exciting and provocative data to hear about. And indeed, that's exactly what happened. We had two wonderful speakers, both of whom are considered world leaders in this topic, and I think people were quite enthused over both of these discussions. We also had a discussion on assessing what are the most appropriate methods of assessing dietary supplementation data by an individual who does systematic analyses and in fact runs a systematic analysis center at Brown University, and that was a very interesting insight as to what is appropriate and what's not appropriate for the purposes of trying to assess the efficacy of a particular nutritional or dietary intervention. We also this year, for the first time, selected several abstracts that had been submitted to this meeting that we thought were, one, of general interest, and two, were of sufficient scientific rigor to be of interest to the entire general audience at this meeting. And we had three outstanding presentations that again engendered quite a bit of discussion afterwards. So I'm very pleased with the way that the meeting's gone so far, and I'm really looking forward to the discussions that are going to occur over the next day and a half. Thank you.